Good morning and welcome to Nonsense Talk News. I am Pallab Ghosh with you. I am at the second Vivekananda Sustainability Summit 2023 at the Ambedkar Bhavan. I have with me Deepti Sharma Joshi.
Namaskar, namaskar.
She is an entrepreneur. She is also a social activist and also spokesperson of the BJP. The reason for being here is also she is one of the organizer of this event. दीप्ति जी, सबसे पहले तो मैं आपसे ये पूछूंगा कि आपने कहा कि आपने हेल्थ सेक्टर में काफ़ी काम किया है और हेल्थ सेक्टर में आपने जो काम किया है कोविड के टाइम से शुरू करते हुए अभी तक आप काम कर रही हैं हेल्थ शी टोल्ड मी एक्चुअली शी इज़ ऑल्सो इन द हेल्थ टूरिज्म. आई विल बी कमिंग टू हेल्थ टूरिज्म लेटर. दीप्ति जी, फर्स्ट टेल मी what brings you to the health sector. How do you explain working in the health sector?
Yeah, it is an age-old journey that I started my career in 1996 when I have completed my BSc and pursuing B.Ed, and after that I have done MBA and we have joined Ranbaxy Laboratories. That was a #1 pharmaceutical company in the country, and I served in Ranbaxy for almost 23 and a half years. Ranbaxy has been sold to Daiichi and then it has worked with Sun for 4.5 years, and so therefore I am a hardcore medical professional in the industry. I've been in live contact with more than 5,000 doctors, mainly specialists and super specialists, and onco is my target field where really I have worked so much in the field of oncology, because as we all know, din pratidin, because of the sedentary lifestyle and the type of the food and the eating habits we are eating, there is a lot of cancer that has developed in our countries these days. So I have started working for the field of cancer in radiation oncology, medical oncology and surgical oncology, and I used to do medical tourism. I used to take the team of the doctors to Afghanistan, Africa, Kenya, Nairobi, Ghana, Singapore, Nepal, Bhutan, and as we all know, India is a medical hub of the world.
Absolutely.
And we have done a lot of advances in the field of medical technology and medical sciences, and still Africa is 20 years behind us. So, and Afghanistan also, it is very much below standards of India in the field. So I have taken 9 specialists from different hospitals: Action Balaji Hospital, Rajiv Gandhi Cancer Institute, Max Hospital, Park Hospital, and Dr. Ritesh from Batra Hospital. I have took these 9 specialists overseas and conducted in health checkup camp, where we have seen more than 570 patients and treated them, given them the right guidance, run the tumor board meetings there, because we have got a technical team of specialists with us, medical oncologists, radiation oncologists and surgical oncologists. In surgical also we have taken gastro-onco with us, as well as head and neck and breast cancer specialist with us. So because these countries are really very poor and they can't afford such treatments, and after Modi ji's becoming the Prime Minister, we have got an honor, and it is very easy from our health ministry to get tied up with the health ministry of other countries. So previously it was very difficult to run the health checkup camps overseas, because lot of paperwork is there. But now after Modi ji is a man of developing India, we have got so much privilege and connectivity with the overseas countries that they wholeheartedly invite us with our medical fraternity to run the medical camps. And recently on 5th, 6th, 7th July in Nairobi, in Africa, we are doing a very big health summit where we are running an expo conference, and we are doing the health camp, and 48 countries we have invited there. So we have started working for that conference also from now. And second Vivekananda Sustainability Conference, as we used to do last year also, it in the form of expo, conference and award. It's a very good thing, because we all are the followers of Vivekananda ji. Vivekananda ji always says, arise, awake and work till the time your mission is accomplished. Your mission and your goal should be focused, and you should work very hard. If you can't fly, then you crawl. If you can't crawl, then you walk. If you can't walk, then run. If you can't run, then do anything by any means, but never stop yourself.
Right. As I was saying, that she has an experience in vast fields actually. Let me now ask you, Deepti ji, you told me that you are also involved in the health tourism.
Yeah.
Now, health tourism health tourism since past few years have been developing immensely.
Yeah.
How do you see the health tourism developing in India?
Yeah, health tourism is basically divided into two zones. One is the domestic medical tourism and another is the international medical tourism. In domestic medical tourism, what we have done, we have opened a virtual clinics and we have aligned our team of the doctors there, and any people who are staying in the remote areas or any doctors who are not having the super specialist segment over there, they give us a call at our number and we will arrange video calls for them. We will take their OPDs on virtual clinics because it is very difficult for them to reach to Medanta doctor, Fortis doctor,
Very true.
Artemis doctor, BLK doctor, and money is also one of the major constraint for these poor patients to reach to these level, and sometimes they are not able to take the decisions in the field of neurology, cardiology, oncology. They are really very confused how to go on with the medical treatment because only doctors are available there in the villages these days, but super specialists are not available. So we run these type of clinics and help these patients almost free of cost and many times at a very low cost, so that we can assess the patient, and we generally talk to their doctors, physicians also, what type of treatments they are going, what types they have undergone, and we recommend them their diagnostic test, and once they send the report to us, we evaluate them with our eminent team of consultants and give them the right opinion how to proceed with their treatments there only. And if some problem is there, we call them here in Delhi, metropolitan cities, where all facilities are there. Yeah.
Right. Deepti ji, if I stay with the health tourism, there are few teething problems. How do you prefer to beat those problems? Like there are touts, there are, because I myself have seen in some of the places where touts, they actually disturb the patients who come from far places. How do you see this problem?
Yeah, this is a very major problem because last time in 2019 when I went to Afghanistan before COVID started, our main motto was there, these transcriptors and these touts, when they come to India, they don't give them the right guidance, and sometimes they take the money and didn't give the treatment. So that is why we came into the picture, because we are a hardcore professionals, people from the medical field, and we know all the doctors depending upon the patient's economic status. Like if the patient is really very poor, so we treat those patients in the government hospital where it is absolutely free of cost. If the patient is of a middle financial status, we send him to a small hospital infrastructure with a good doctors there. But if the patient is a VIP and a VIP patient or some ambassador of any country, we give them opportunity, we give them so many hospitals, we guide them, and according to their own choice, we provide the medical treatments to them. And some